What's up, everyone? This is Isaac from Hunger Smash Fitness. I want to do a video today on something that I've been hearing more about lately, it seems like, but it's called the sick aging phenotype. And I feel like it's been being talked about a little bit more just with coronavirus, especially because usually those who are more at risk are those who fit the profile for the sick aging phenotype. So just to start off, the difference between a phenotype and a genotype. So phenotype comes from the Greek phanon and typos, I think, which is basically show type. So it's symptoms that you show. It's things that an organism shows. So a phenotype would be obesity or vascularity or something more along those lines, something visual that you can see. Whereas a genotype, so that would be more from the genes, something that your DNA is causing your body to do. So something more along those lines would be, it'd be a genetic component, so brown eyes or blue eyes or something more along those lines. So just to separate those two first, a phenotype versus a genotype. Phenotype is going to be something that is shown. It's a symptom of something. So it's not necessarily inherited. It's something that is collected over time, I guess. Almost collected. So the sick aging phenotype is fairly complex, but it can really be summarized with 5 main attributes, okay? So that's metabolic syndrome, sarcopenia, osteopenia, frailty, and polypharmacy. So metabolic syndrome, it can have a bunch of different symptoms and disorders and everything that occur together. So it can have different definitions and clinical criteria based on where you are and who's diagnosing you and all that sort of stuff. But essentially, there's a couple main components. So the first of which is visceral obesity. So this is the accumulation of fat around the internal organs of the body. So the second is insulin resistance and hyperglycemia. So this is the loss of cellular sensitivity to insulin signaling. So this can include both diabetes and pre-diabetic states. The third would be hypertension, which is elevated blood pressure. Fourth could be dyslipidemia, which is derangement in serum triglyceride, which is fat, and HDL and LDL levels, which would be the cholesterol. The fifth, it's not a classical component of metabolic syndrome, but you see it a lot, and that's inflammation. Just general inflammation. It can be, it's from chronic pain and damage to tissues. The body can get caught into this inflammatory response, which is really difficult to break from. So it seems like one of the big drivers behind all 5 of these is obesity. So obesity in and of itself isn't necessarily going to cause the sick aging phenotype, metabolic syndrome, all that sort of stuff, but it can be a contributor. So obesity, I think we all know people who have extra weight, carry around extra weight, but still glow with health. They're still, their vitality is great, they're still active, performing well. So that's not necessarily what we're as focused on, because obesity it's extremely multifactorial. There's a bunch of different factors that can play into obesity. The biggest thing that I want to focus on with the obesity is exercise. So obesity, it's built up of energy in versus energy out. So what we're eating versus how much energy we're expending, how much we're actually using, and how much we're storing for later. So one of those ways which I've talked about a little bit before, but one of the best ways to increase the energy expenditure. So diet and everything is wonderful. Energy expenditure, one of the best ways to increase that over time is to increase your resting metabolic rate. And basically the best way to do that is to build more muscle. The more muscle that you have, the more calories you're going to be burning. So the best way to be increasing energy expenditure is by increasing your resting metabolic rate, building muscle mass. So the second one that I wanted to talk about is sarcopenia and osteopenia. So sarcopenia is the loss of muscle mass. Osteopenia is the loss of bone mass. And these are not true components of the metabolic syndrome, but they are fellow travelers. So they don't necessarily, they're not necessarily caused by metabolic syndrome, but typically if you have metabolic syndrome, you will be seeing these as traveling along with it. So you'll end up getting both. And these are both components of the sick aging phenotype, the general umbrella term. So sarcopenia especially can be affected kind of how we talked about just before with the reduced insulin sensitivity, the insulin resistance. So insulin is a growth factor, so it's actually needed to build muscle and to maintain muscle. So sarcopenia oftentimes goes along with metabolic syndrome because of that insulin resistance. You're resistant to that growth factor, and so then what ends up happening is your body ends up not being able to repair and build the muscle tissue the way it should. So this brings about muscle atrophy, which is a loss of muscle mass due to shrinking of muscle cells, connective tissue, sarcopenia, and then the loss of, sarcopenia is the loss of the muscle cells themselves. So muscle atrophy can be reversed, but once a muscle cell dies, it is difficult or impossible to replace it. So this is something that you want to keep in mind. With the insulin resistance, you have increased muscle atrophy. So when you have a sedentary lifestyle combined with insulin resistance and metabolic syndrome, it's kind of the perfect storm to reduce muscle mass. So because the muscles are not recognizing that growth, the growth signaling, and then it has that decreased total body insulin sensitivity. So then unused and detrained muscles downregulate their insulin receptors, turning off protein synthesis, and it actually begins to eat itself to provide calories and amino acids to the rest of the body, which because of the decreased insulin signaling, thinks it's hungry. So it starts this really bad chain reaction where the body starts to actually break itself down because it's constantly thinking that it's in a hungry state. And so it's trying to provide fuel for itself, but it's not actually hungry. It's just that the sensitivity isn't there. So it can't recognize the receptors saying that it is satisfied. So the result of this is a progressive loss of muscle tissue and strength. And then as your muscle mass and strength decreases, activity becomes more tiring, more fatiguing, and more uncomfortable. And so then you become more likely to be inactive, which loops back around and so it just gets into this spiral where this chain reaction where one thing leads to the other, which leads back to the beginning. So all of these that we've talked about so far are building up to the general frailty that we see with the sick aging phenotype. So the inactivity, the muscle atrophy, the high blood pressure, his blood pressure is creeping up, muscles are slowly wasting away, strength is declining, the bones are more brittle because they're not getting that signaling, the tissues are more prone to inflammation and degeneration. All of this just continues to build up more and more, and and it leads to this very frail, older organism. So because of all this other stuff that's going on, eventually the insulin resistance turns into full-blown diabetes, and then you end up getting put on metformin or something along those lines to try and control the diabetes, which the medications are effective for a time, but since they're not getting at the root of the disease will continue to progress. So it'll help mask and cover some of the symptoms, but it's not actually curing anything. It's just putting a Band-Aid on an open wound. And then with the high blood pressure, what typically happens is the doctors will prescribe multiple blood pressure medications, which do well to keep you from actually blowing a gasket, basically. It helps control your blood pressure, but it doesn't actually fix anything, and it can, a lot of the times they can make you fairly lethargic or dizzy, which can actually increase your sedentary lifestyle, which, as we just talked about with the frailty and everything, you're already on this circular roller coaster that just keeps going round and round and round. And so when you're adding medications that are gonna decrease your likelihood for activity, it actually speeds up the process of how fast everything is declining. So then combined with all that, so with the inactivity, bones need signaling to repair. So for a bone to heal, it actually needs weight bearing. It actually needs signaling to tell the body we need to strengthen this bone. So as the sick aging phenotype becomes more sedentary, the bones actually become more brittle. And so you're starting to get this picture that the body is falling apart and becoming very easy to break. So as everything wastes away, the risk of injury, the risk of falling and breaking a hip, anything along those lines is becoming higher and higher. So as all of this is progressing, then we start to see a lot more of the polypharmacy showing up. So polypharmacy basically just means lots of drugs. So already, I mean, you're at this point, they'll be on insulin, metformin, Cardizem, Zantac, Senna, a lot of other drugs, okay? And they're all for fixing something. But the downside of this is that a lot of these drugs work antagonistically or synergistically with each other in unfavorable ways. And so they can actually increase problems. They can cause more problems than they're currently fixing. All these medications that the sick aging phenotype is on aren't actually fixing anything. They're all just putting a Band-Aid on an existing problem, and they're not actually correcting anything from the underlying problem. They're not curing the disease, they're masking the symptoms. And this is why a lot of these end up with heart disease and stuff like that, similar issues, where the high blood pressure eventually, it'll open a crack in a coronary artery or something along those lines, which is known as the widowmaker. The body is unable to respond because of all the medication it's on, because of how weakened it is. It's unable to respond properly when something traumatic happens. And so that's why we see with the aging population, a lot of the times it's not one single thing that hurts or damages or kills anyone. It's a combination of all these factors that are all working together to bring the person down. So the sick aging phenotype, it's self-reinforcing. So weakness and decline bring about more weakness and decline, and it just continues to circle the drain, bringing everything further and further down until there's not really anywhere else for them to go. So the problem with a lot of this is that in our modern society, medicine has become synonymous with drug. instead of looking for something that we can do to help correct the problem, to help reduce the comorbidities and all that sort of stuff that's going along with it, instead of looking for that, we look for a pill that we can take that's going to reduce the side effects so that we don't realize that it's there as much. So we're not actually fixing anything, we're just hiding it. We're just burying it a little bit. So the one thing that we have found that actually helps correct a lot of this is exercise. So no drug in the world is going to be able to match the power and effectiveness of exercise. So some of the benefits of exercise are going to be on the musculoskeletal system, cardiovascular, metabolic health. It improves your cellular health, neurological health, and psychological. It improves your mindset. It improves everything. If you've noticed that you're sad or depressed or something and you go out and take a walk and you come back and you feel so much better, exercise affects everything. It improves the landscape of all of these. So the one downside with exercise is that it's self-administered. There's no doctor that can prescribe you, 15 minutes of exercise every day, or they can prescribe you it, but it's up to you to actually take it. So that's the one downside with exercise, is a lot of people have reached that point where they don't feel well, they're tired. Exercise just seems so exhausting to go and do something along those lines. And that's one of the things that I've seen with physical therapy as well, is trying to get people to do their exercises. And this is something that a lot of the PTs, PTAs, everything that I talk to have all discussed, is that you can prescribe the best exercise for someone in the world to possibly do, but they have to do it. And that's the problem that we see with the sick aging phenotype. Nothing against television, Hulu, Netflix, Facebook, anything like that. But that's so much easier. To actually go out, lift some weights, to actually go out, move your body when you're tired, when you don't feel good, when you have high blood pressure, everything else, it's exhausting to even think about. And that's where we come into that's where we have the main problem, is that exercise it's not a simple fix. It's something that takes time, especially with the progression of the sick aging phenotype. It's not something that can be corrected in one day or even necessarily in 1 year, but you can make steps in that direction. And that's a big part of why I wanted to establish this channel, is to encourage people to do that. If these things scare you or worry you, they don't need to. It's fairly simple to avoid a lot of these, or not simple, but because there's so many things that they're so multifactorial. But just being proactive, going out, doing some exercise, lifting some weights, working on that little improvement every day can actually have a huge life-changing, life-altering outcome where you can actually see drastic changes. That's one of the things with Stan Efferding and the vertical diet. That's one of the things that I've really appreciated with him, is that he's working to help people to lower blood pressure, all this other stuff, not through nonsense, but he goes at it more from the diet point of view. And it's a combination. Nothing is a single thing. All of it is multifactorial. So the sick aging phenotype, from my perspective, working in physical therapy, how I want to help people is through exercise. That's the modality that I feel like I can help them with the most. The diet and nutrition interests me as well, but I don't have any formal training in it. Everything that I know is just from stuff that I've read, things that I've I've come up with. The exercise side of it is much more my area of expertise. If that interests you or someone that you know, let them know that it doesn't have to be the end. You can hire a personal trainer. I would recommend finding someone who is actually experienced with what you have going on. Find a physical therapist if that's what you need. Don't just download some exercise program off the internet, because they're built for everyone, which means they work for no one. If you have risks, if you have things that you need to be careful of, don't watch some video. Go find someone who's an expert in that field, in that area, and have them work with you to get better. And there are lots of people out there who can do that. That was just what I wanted to talk about today. The sick aging phenotype, especially with coronavirus on the rise, the sick aging phenotype, they are the ones who are at risk. The ones with heart disease, diabetes, all these other stuff, because the body's weakened. It can't fight back properly. It can't respond properly. It's in a weakened state. It's frail. If that is you or someone that you know or a loved one, let them know that there is a fix to that. You don't have to be on a ton of drugs, but it's not going to be an overnight fix. It has to be something that you work at every day or several days a week. It has to be something that you come up with a plan, that you attack it appropriately, and that it's not going to be just an overnight fix. So I feel like coronavirus has put a lot of this into the spotlight, and I feel like there's been a lot more people talking about it, but it doesn't have to be you. That's all that I have for today. Once again, this is Isaac with Hunger Smash Fitness. Just encouraging you to always improve that 1%. Always work on that little thing. It's just something little every day. Try to get a little bit better. So that's all for today. And please be safe out there. And just help those that you come across that you can help. And that's it.